So people that come to our office complaining of foot pain with a kind of nervy component, like maybe like they're walking, they kind of feel like there's a pebble in their shoe, or they're walking, they'll hear maybe like a snapping or like a cracking sensation, and then they'll make it like a shooting, burning kind of nerve pain. Oftentimes that patient has what's called Morton's neuroma, which basically means that, you know, all these little nerves that are kind of coursing through the bones in your foot, what can happen is if those bones are moving too much, like if those tissues that are supposed to hold them together just aren't strong enough to do so, what can happen is those bones can shift, and then that little nerve that runs in between them might get pinched or kind of like pressure placed on it because of that improper bone movement. So that's commonly called Morton's neuroma, meaning that, okay, if those bones are moving so much that it's putting so much pressure on that nerve, you can actually get swelling of that nerve, or a neuroma that causes like a burning, tingling, maybe even like a numbness feeling at the ball of your foot or even into your toes. Oftentimes, patients, you know, they've tried kind of everything that their insurance will cover, right? So they've tried cortisone, they've maybe tried physical therapy or massage, they're wearing like wide base shoes, maybe they've got an arch support or, you know, the support on the ball of their foot. They've kind of tried orthotics, you know, all of those things, and it's still not where they want to be. Or maybe, oh, the symptoms are controlled as long as I don't do anything. Well, that's not ideal. You know, you want to hike, you want to run, you want to do all these activities. You want to make sure that you're getting to the root cause of that issue to allow you to do those. And so, you know, like I said, by the time patients come here, they've usually exhausted all of those options. So prolotherapy is an injection technique that stimulates repair of tissue. So if we have someone that has like that instability in what we call like the metatarsal joints, or like the joints at the ball of the foot, what we'll do is we'll actually do injections into those tissues to get them to kind of become strong, almost like we're tightening up a rubber band a little bit. And what that'll do is, one, it can help get rid of pain, it can provide more stability to those bones, and two, get the pressure off of that nerve. You know, if those bones are being held stable and strong, there's not going to be any of that extra friction on that nerve that lies between them. What we also do sometimes as well is actually do some injections around the nerve to try to calm down that neuroma or draw any swelling off of the nerve to help that the pain, burning, tingling sensations go away as well. Sometimes patients will even, you know, they've seen a chiropractor for months or years or whatever for their Morton's neuroma. Like they'll say, hey, you know, I can feel that my bones are shifting. If my chiropractor just puts them back in place, I feel great, but then it comes back. Well, that's another sign that we actually need to do prolotherapy to strengthen up these tissues so they're held in alignment and you're not just, you know, chasing the symptoms forever.